In general, our goal at Legacy Spine Neurological Specialist is to try to come up with the least invasive treatment possible, as we've talked about repeatedly. And when we have to perform surgery for very certain select conditions, with indications being some form of damage to a nerve, because again, as I stated in the talk about lumbar degenerative disease and surgical degenerative disease, surgery is not appropriate for back and neck pain due to disc degeneration. Where surgery can become appropriate is if these conservative measures we've talked about with spinal injections and physiotherapy protocols and medications, if those fail to achieve the stated result, or desired result, if those fail to achieve the desired result, or the pressures on the spinal cord, and it's causing spinal cord damage. Again, that's not a nerve, but the spinal cord is the major relay station from the brain to the arms and legs. And if that's damaged, then it is very unlikely that conservative care has any role. It almost always has to have surgery when the spinal cord is damaged, but not when a nerve's under pressure. So in the lumbar spine, the most common surgeries we're going to do is called a laminectomy. And there's different ways to do that. But it's the removal of this bone, this shell called the lamina. And to remove that shell is the purpose is to get down and remove the overgrown bone or ligament, or both, and then shave off any part of the disc that may be blown out or herniated or pushing back against the nerve. People often ask me about artificial disc replacement and lumbar fusions for back pain or neck pain, cervical fusions for neck pain, and I tell them I simply cannot recommend that because it's rarely ever indicated or rarely ever successful. Instead, surgery is used for damaged nerves.